In our daily practice, elderly patients are a large population. These patients have a very precarious balance, because they have more frequent problems, and on them there is also a very large emotional investment by the owner, because they're the companions of a lifetime. In this type of patients, we generally have to face more than one problem and therefore treat more than one pathology. For this reason, we will need more than one instrumental method to adapt our protocol to their needs. We can have an example with Lipo, just to realize how to deal with these patients. Lipo is a golden retriever, a 9.5-year-old male, so he is about to age. We are at the very beginning. He is slightly overweight because he has a body condition score of 7. Therefore he weighs 37 kilograms. He is free from hip dysplasia. But he has elbow dysplasia, with the right going definitely worse than the left, and he has had a fluctuating lameness on the front left limb, so actually the best limb, for a couple of years. Here we can see the X-ray, where subchondral sclerosis is evident, which is a sign of suffering in the elbow joint. On the left elbow we can see a better situation, but nevertheless there is a severe arthrosis of the carpus. As we visit Lipo, we notice that for 2 days he has had a 1-grade lameness of the front left limb. There is a lot of pain when manipulating the left carpus, especially in flexion, and there is a rattle of the right elbow, which is a sign of joint pain. At home, the owners have administered some arnica, without any improvement. During our physiatric visit we take some articular excursion movements, and in addition to experiencing considerable pain in the left carpus, we also notice movements that have decreased compared to those that should be normal. The flexion of the carpus stops at 70 degrees instead of 32 degrees, while the other joints are normal on average. This is what Lipo looks like, so it is also possible to see macroscopically a bulge in the carpus, a bulge that is hard, because it is a bone deformity created by the presence of arthrosis. Therefore, our rehabilitation protocol includes a treatment with laser for the right elbow, because in any case radiographically we have seen the presence of arthrosis. TECAR on the left carpus, because it is the most painful joint, and laser always in the left carpus. Why did we choose these methods? We have chosen TECAR, and used it on the most painful joint because, compared to laser, with which it shares many beneficial effects, TECAR has a greater analgesic effect, an effect that is remarkable, extremely rapid, to the point that the owners immediately notice the effectiveness after 1/2 treatments, noticing the improvement in the well-being of their dog. We do not use TECAR on all joints, therefore also on the elbow, for a matter of time, because it is a medium-length application. With TECAR the duration of the treatment is 15-20 minutes, while with laser we speak of 4-5 minutes for an elbow, and we don't want to abuse the patience of our patient. However, the laser, in this case on the elbow, and also on the carpus, may be sufficient, because it helps to manage the problems and the inflammation at the cartilage level. It helps to stimulate the healing, and reduce at the same time the inflammation. To a lesser extent than TECAR, but enough to ensure the well-being of our patient. To this, we have subsequently associated exercises, both passive and proprioceptive, all this a couple of times a week, and here you can see Lipo as he walks. It is possible to notice a slight lameness in the right anterior limb. After 4 treatments, unfortunately, a break was made for personal reasons of the owner, and when the dog returned, obviously the lameness was still present. But from that moment, we began to add the underwater treadmill, to improve posture and strengthen the muscles, which in an elderly patient is absolutely fundamental, all of this twice a week. Here we can see Lipo at recovery. with a minimal but nevertheless present lameness. After 10 treatments, we move on to 1 treatment per week. There is no more lameness, so we also remove the laser on the carpus. Lupo at home is no longer required to rest. As you can see, he no longer limps, so he is a happy dog again, free to do whatever he wants, to be able to age peacefully.